What's some of the other data, as we talk about the work that you've done that is compelling? Is Twitter an epidemiologic tool too?
It can be. There's some fascinating work. So I'll just share one story about what we identified in our study that I did with surgeons. Are we connecting with them? And would they retweet based on not knowing me personally, and clearly I'm not a surgeon, would they retweet something from me because Dr. Naomi liked it or tweeted it? And if it was attached to something, so there was a link to a PubMed abstract, there goes the evidence base, the scientific, analytical part of being in healthcare. And I provided them a link to an article that described this drug-resistant infection in surgical wounds, again, keeping it relevant to them. Or, this antibiotic class causes a high prevalence of C. diff, Clostridium difficile. Surgeons get get the consequence of C. diff because fatal C. diff is a surgical emergency.
I think even consumers.
Yes,
C. diff
and
is
they
a
do.
consumer term now,
You've
right?
got it.
Yeah.
They've got it. So the one tweet that resonated the most was this KPC outbreak, Klebsiella pneumoniae carbapenemase. It's a resistance to a gram-negative that was fairly new at the time. So surgeons that use duodenoscopes for procedures and clean them according to the manufacturer directions, well, KPCs weren't around when the tools were developed. So the cleaning technique, the sterile technique, could not kill a KPC. So UCLA had this outbreak, and actually patients died from the untreatable KPC, gram-negative infection, contaminated duodenoscope. So a surgical procedure, an elective surgical procedure, actually killed the patients. So you can imagine as a surgeon, the liability you've now got and how horrid you would feel.
Certainly.
And so as that outbreak was occurring, it was the front of the LA Times. It's happening in real time. I know they may not even know what this KPC stands for, nor the most important clinical thing. What antibiotic do you give to someone who acquired this from my procedure?
Yes. Sure.
So I linked it to a medical article on management of KPC infections, gram-negatives. What are the appropriate antibiotics? That was the most retweeted tweet. That one tweet that was retweeted by Ben Naomi, reached 15,800 people, most of them surgeons. That's the power of Twitter. That was in real time, John. If I waited for the UCLA outbreak to be published,
be a year, right?
Exactly, it was 1 year later. So that was the value of it, personally, in our story.
What about the value of Twitter as a tool in academic institutions or congresses, meetings,
So
ID
powerful.
Week?
Yep.
I think that people completely miss that.
So you're correct. And so I was at ID Week and I was a power tweeter because they know I have a bigger network and I enjoy tweeting. Everybody can't be at the meeting for whatever reason. A, there's no funding to send you. The timing isn't right. You're on service taking care of patients and you can't be gone. So there's many reasons. But wouldn't you like to know what's breaking news happening at your national meeting, except I can't be there? Tweeting allows you to disseminate outside of the walls of the meeting. You reach a much bigger audience and you can reach global.
And it's not only inside out, but it's outside in.
Yes.
So I can attend ID Week virtually.
Yes.
Right? Because I've got power tweeters like you doing all the hard work to consolidate 2 or 3 hours of talks into 1, 2, or 3 key points. And once you build the trust with that individual, you really want them to...
Right. And so, again, I learned that from my surgical colleagues.
Sure.
The American College of Surgeons, I think there's 20,000 surgeons that attend that.
Yes.
And, surgery is very siloed. You're a GI surgeon, you're a heart surgeon, so they don't even cross paths. But at the American College of Surgeons, it's everybody. So they have power tweeters that are tweeting galore. And it really just allows, if I'm presenting breaking work, I want my work to be known and recognized. I'm not presenting it just for the audience there. It allows me to have someone tweet my work, and now all of a sudden, a much bigger audience is seeing my research, not just the attendees.
You know, it's like publishing a paper.
Yes.
And having that paper referenced a lot.
Yep.
And that, I mean, that's the basis for Google search, right? That's how they structured relevance, search relevance. But to me, it's really interesting because if you publish a paper, you want it to go in a prestigious journal. You want to
Sure.
have that gravitas. But you don't want it to disappear into academia. So, I mean, that's a publication channel, a dissemination
Right.
channel.
And
you know, that's
it's
very
so powerful.
Yeah.
You know, journals now keep metrics on
Sure.
how, I mean, a journal is a business. They're in the business of publishing. They want those articles requested, they want reprints purchased, and they want the work disseminated. So, you know, the abstract is like a little teaser. You get to see a little bit, but if I'm reading a study,
Yes.
and I read the abstract and go, oh, I need to know more details because I'm actually going to do this for my patient. I need to know all the facts, not just a little teaser. And if I don't have a subscription to that journal, I'm going to purchase that.
Yes.
So journals now have realized the value
It's a
of
business
Twitter.
tool, right? It sure-
Exactly.
But also hospitals promote good stewardship as a reason why you should go to that hospital. I mean,
Exactly.
they're
it's
powerful.
self-promotion. I mean, we're in the business of
So-
running a hospital.
I think that, you know, that some clinicians might cringe when they hear the word power tweeter. Oh my God, a power tweeter.
Yeah.
What is a power tweeter? And is gamification, and you have to be truthful on this, isn't it nice to have your tweet become a top tweet?
Absolutely, sure. And especially when people with influence pick up your tweet.
Yes.
You know, it's like, oh my gosh. So one of my most exciting moments on Twitter, so at the American Society of Microbiology conference 2 years ago, Bill Gates was the keynote speaker. So Bill Gates on Twitter put out a tweet. Tweet me a question, and if selected, you're gonna have a one-on-one dialogue.
Wow.
Well, I jumped on that, knowing there's only a handful of us on Twitter. I have a good probability of my tweet. So I sat with my physician, Julie Mangino, and I go, who is not on Twitter, working
okay.
hard on that. And I said, 140 characters, help me language a compelling question.
Yes.
And we literally spent 40 minutes trying to get what we wanted to ask down to 140 characters. And she's like, why is it 140? I go, that's a different discussion. Okay, and now it's longer.
Now
But
we've got, we've
at
doubled
the
it.
time. And guess whose tweet
Wow.
was selected by Bill Gates?
So-
I had the opportunity to have Bill Gates
So what's the
speak my
likelihood?
name.
What's the likelihood of you getting a call to Bill Gates? Pretty tough, right?
Oh my goodness, yes.
Email, right? B Gates at micro, whatever it is,
Right.
or the Gates Foundation. Almost impossible.
Yeah.
So here's the way that you can reach out to these people, and I think that may be an interesting tactic. That at a clinical conference, at Grand Rounds, maybe a day or two before Grand Rounds, here's tweet your question. And it doesn't become just the people in the room, it comes medical students from around the world, all sorts of interesting.
You know what I love about
yeah.
hierarchy, or about Twitter? There is no hierarchy.
Yes, exactly.
So I have taught my younger colleagues starting their profession, and the surgeons have absolutely identified this, that there is no hierarchy. If you have knowledge, it doesn't matter what your age is. If you have something that can be shared to help others, you can really become well respected on Twitter and get recognized by your own peers
Completely.
as really an expert.
You know what it is?
It's so cool.
It's a cognitive hierarchy.
Yes.
It's the
Yeah,
power
that's a great way of saying
the
it.
idea.
Yeah.
And I mean, it cuts both ways. You can say
Right.
something stupid and
Well, I
embarrass
caution
yourself.
them.
You have to be careful.
Right.
But I really haven't found a lot of that on the clinical side. I mean,
No, I think healthcare providers clearly
They get it.
understand
They
they're
get it.
held to a higher bar. Tweet responsibly. Don't give medical advice. You never know how people. You can't give you can't give a dissertation on Twitter, so you have to be very careful. You're not giving medical advice, but it's a powerful tool.
great. This is a fascinating discussion.
Thanks.